Welcome to today's video about hydrochlorothiazide side effects. Every day, millions of people around the world take hydrochlorothiazide to manage their blood pressure. This medication has been trusted by doctors for over 6 decades and remains one of the most commonly prescribed diuretics globally. It works effectively to reduce fluid retention and lower blood pressure. However, beneath this trusted reputation lies a series of side effects that scientific research has consistently documented. The research we're exploring comes from peer-reviewed medical journals, large-scale clinical studies, and systematic reviews conducted by leading researchers worldwide. These aren't theoretical concerns or rare case reports, but rather well-documented side effects that occur with measurable frequency among hydrochlorothiazide users. Today, we'll examine 9 side effects of this medication that have been proven through rigorous scientific research, giving you the knowledge you need to have informed conversations with your healthcare provider about your treatment options. Now, to make this clear and simple, let's start with the first hydrochlorothiazide side effect: electrolyte imbalances. When hydrochlorothiazide enters your system, it fundamentally changes how your kidneys handle electrolytes, particularly potassium, sodium, and magnesium. Research published in the American Journal of Medicine has demonstrated that electrolyte imbalances represent one of the most common complications of thiazide diuretic therapy. A comprehensive cross-sectional study examining over 1,600 patients taking thiazide diuretics found that approximately 19% experienced hypokalemia, meaning dangerously low potassium levels. The same study revealed that 22% developed hyponatremia, characterized by abnormally low sodium concentrations. The mechanism involves 2 primary pathways. First, hydrochlorothiazide increases sodium delivery to distal tubules where it gets exchanged for potassium, leading to excessive potassium loss through urine. Second, the medication triggers secondary aldosteronism, where your body produces elevated aldosterone levels, further promoting potassium excretion. Research shows these effects can persist for 24 hours or longer after each dose. This side effect can cause serious cardiac complications. Studies document that even mild chronic hypokalemia is associated with adverse health outcomes, including increased mortality risk in patients with cardiovascular conditions. Symptoms range from muscle weakness, fatigue, and cramping to dangerous cardiac arrhythmias requiring immediate attention. Research indicates that female patients, elderly individuals, and those taking higher doses face substantially elevated risk. A British study examining primary care patients found that among those who had electrolytes monitored, approximately 21% showed abnormally low sodium or potassium while taking thiazide diuretics, underscoring how common this complication is in clinical practice.
Next, side effect 2. Elevated blood sugar and diabetes risk. One of the most significant metabolic concerns associated with hydrochlorothiazide use is its effect on glucose metabolism and insulin function. Research published in the New England Journal of Medicine has established that thiazide diuretics substantially alter how your body processes sugar. A systematic review found that hydrochlorothiazide decreases insulin sensitivity, leading to increased baseline insulin concentrations and heightened late insulin response to glucose intake. The mechanism involves multiple pathways interfering with normal glucose metabolism. Studies demonstrate that hydrochlorothiazide reduces the pancreas's ability to secrete insulin effectively while simultaneously making body tissues more resistant to insulin's effects. Research indicates these changes can occur relatively quickly, with measurable increases in fasting blood glucose appearing within weeks of starting treatment. For individuals with prediabetes or metabolic syndrome, this medication can represent the critical factor pushing them into full diabetes diagnosis. Clinical evidence supporting this connection is substantial. Long-term observational studies show that patients taking hydrochlorothiazide have significantly higher rates of developing new-onset diabetes compared to those using other blood pressure medications. Research comparing different antihypertensive drugs found that while hydrochlorothiazide effectively lowers blood pressure, it adversely affects lipid and glucose metabolism in ways other medications do not. One study documented that true glucose intolerance develops in approximately 3% of patients taking thiazide diuretics, though this condition is typically reversible within 6 months after discontinuing medication. The clinical implications extend beyond simple blood sugar elevation, as the metabolic effects can potentially undermine cardiovascular protection the medication is meant to provide.
Next, side effect 3: elevated uric acid and gout. Hydrochlorothiazide has a well-documented effect on uric acid metabolism that significantly increases gout risk. All thiazide diuretics, including hydrochlorothiazide, inhibit the kidney's ability to excrete uric acid, causing it to accumulate in the bloodstream. When uric acid levels become sufficiently elevated, microscopic crystals form and deposit in joints, triggering severe inflammation and pain. Scientific research has consistently demonstrated this association. Studies show that hydrochlorothiazide is particularly problematic for individuals already at risk for gout. The medication can elevate serum uric acid levels substantially, and research indicates that doses of 25 milligrams daily or higher significantly increase gout incidence. Clinical data reveals that males, individuals under 60 years of age, and patients with family histories of gout face higher risk. The condition typically manifests as sudden, severe pain in a single joint, most commonly the big toe. What makes this side effect particularly frustrating is its unpredictability. Some individuals take hydrochlorothiazide for years without experiencing gout symptoms, while others develop their first acute attack within months of starting treatment. Research examining the relationship between hydrochlorothiazide and hyperuricemia emphasizes that this elevation in uric acid translates into real clinical consequences requiring additional medical treatment. The pain associated with gout attacks can be so severe that patients cannot bear weight on the affected joint, cannot wear shoes, and struggle with basic daily activities. Many patients require additional medications specifically to manage uric acid levels, adding complexity to their treatment regimen. Studies suggest healthcare providers should monitor uric acid levels in patients taking hydrochlorothiazide and consider this risk factor when selecting antihypertensive therapy.
Next, side effect 4 is photosensitization and skin cancer risk. Hydrochlorothiazide possesses photosensitizing properties that dramatically increase skin vulnerability to ultraviolet radiation damage. Research published in dermatology journals has extensively documented that this medication enhances ultraviolet absorption in skin tissue, leading to increased susceptibility to sun damage. Studies show hydrochlorothiazide acts as a chromophore, absorbing UV radiation and transferring energy to adjacent DNA molecules, forming potentially mutagenic dimers. Clinical manifestations range from acute photosensitivity reactions to long-term increased cancer risk. Laboratory studies published in Photochemistry and Photobiology demonstrated that hydrochlorothiazide enhances UVA-induced DNA damage in human skin cells. Patients taking this medication can develop severe sunburn-like reactions after minimal sun exposure. Some individuals report experiencing significant skin redness, blistering, and pain after just 15 to 20 minutes outdoors, even on overcast days. More concerning is the accumulating evidence linking long-term hydrochlorothiazide use to increased skin cancer risk. A landmark Danish nationwide case control study found that high cumulative hydrochlorothiazide use, defined as 50,000 milligrams or more, was associated with substantially elevated risks of both basal cell carcinoma and squamous cell carcinoma. The study revealed odds ratios of 1.29 for basal cell carcinoma and 3.98 for squamous cell carcinoma in high-dose users. A systematic review published in BMC Medicine confirmed that hydrochlorothiazide is associated with increased risk for non-melanoma skin cancer, especially squamous cell carcinoma, in non-Asian countries. Research in Japan found hydrochlorothiazide users had a 58% increased hazard ratio for developing skin cancer. Based on these findings, the FDA approved changes to hydrochlorothiazide drug labels in 2020, recommending patients protect skin from sun exposure and undergo regular skin cancer screenings.
Next, side effect 5, kidney function impairment. While hydrochlorothiazide depends on kidneys to exert therapeutic effects, paradoxically, the medication can cause kidney damage over time. Research published in the Clinical Journal of the American Society of Nephrology has documented cases where hydrochlorothiazide contributes to declining renal function through multiple mechanisms. The medication can cause acute interstitial nephritis, an inflammatory condition affecting spaces between kidney tubules, as well as long-term structural damage. Clinical studies show significantly higher rates of acute kidney injury in patients taking thiazide diuretics compared to those not using these medications. Research specifically examining hydrochlorothiazide found that approximately 2 to 3% of long-term users developed signs of kidney impairment directly attributable to the medication. One particularly concerning aspect is how silently this progresses. Most patients experience no obvious symptoms until kidney function has significantly deteriorated, typically only discovered through routine blood tests showing elevated creatinine levels or reduced glomerular filtration rates. Animal studies have provided insight into the mechanisms involved. Research on rats showed that adding hydrochlorothiazide to other medications resulted in a 40% increase in plasma creatinine levels, indicating substantial reduction in kidney function. Long-term exposure studies revealed detrimental changes in kidney morphology, including severe interstitial lesions, tubular dilation, fibrosis, and increased inflammation. These structural changes can become permanent, potentially progressing to chronic kidney disease. Research published in the American Journal of Kidney Diseases noted that risk of kidney complications increases with higher doses and longer duration of use. Studies comparing different antihypertensive medications found patients taking hydrochlorothiazide for more than 5 years showed measurably higher rates of chronic kidney disease. The good news is that discontinuing hydrochlorothiazide often leads to improvement, though some patients experience irreversible damage.
Side effect 6, sexual dysfunction. Sexual dysfunction represents one of the most distressing yet commonly underreported side effects of hydrochlorothiazide therapy. Clinical research has established that this medication can cause various forms of sexual impairment in both men and women. A study published in the Journal of Clinical Pharmacology found that approximately 56% of middle-aged hypertensive men taking hydrochlorothiazide experienced some form of sexual dysfunction, compared to only 11% in unmedicated control groups. For men, erectile dysfunction represents the most frequently reported sexual side effect. Research demonstrates multiple mechanisms contributing to this problem. Laboratory studies on mouse corpus cavernosum tissue showed that hydrochlorothiazide increases smooth muscle contractile activity by 64%, directly counteracting relaxation necessary for achieving erections. The medication potentiates response to vasoconstrictors, making it more difficult for adequate blood flow to reach penile tissue. Additionally, research suggests hydrochlorothiazide may interfere with nitric oxide pathways crucial for erectile function. Clinical studies comparing different antihypertensive medications found that hydrochlorothiazide treatment was associated with greater decrements in penile buckling pressure and more subjective complaints of sexual dysfunction. Research examining sexual function using objective polysomnographic evaluations documented measurable reductions in nocturnal penile tumescence quality during hydrochlorothiazide treatment. Some studies suggested the medication may cause sexual dysfunction through zinc depletion, as hydrochlorothiazide significantly decreases serum zinc levels, and zinc is essential for male sexual health. While less extensively researched, women taking hydrochlorothiazide have reported decreased sexual desire, difficulty with arousal, and reduced satisfaction. The psychological and relationship impacts can be substantial, affecting quality of life and intimate partnerships.
Many patients discontinue necessary blood pressure treatment due to sexual side effects, highlighting the importance of addressing this openly with healthcare providers.
Next, side effect 7, adverse lipid profile changes. Hydrochlorothiazide can negatively affect cholesterol levels, potentially counteracting some cardiovascular protection it provides through blood pressure reduction. Research published in the New England Journal of Medicine has documented that this medication causes unfavorable alterations in lipid metabolism. Clinical studies show hydrochlorothiazide treatment leads to measurable increases in total cholesterol, low-density lipoprotein cholesterol, and triglyceride levels. The magnitude of these changes varies among individuals, but research indicates they typically occur within the first few months of treatment and persist with continued use. Studies have documented that hydrochlorothiazide can increase serum total cholesterol by approximately 11%, LDL cholesterol by 12%, and VLDL cholesterol levels by up to 50%. While these percentages might seem modest, for patients already struggling with borderline elevated cholesterol, such increases can push lipid levels into ranges requiring additional pharmaceutical intervention. The clinical significance extends beyond simple laboratory values. Research has shown that these changes in cholesterol profiles can contribute to increased coronary heart disease risk, potentially undermining cardiovascular benefits achieved through blood pressure reduction. Studies comparing hydrochlorothiazide with other antihypertensive agents found that medications like ACE inhibitors have more favorable effects on lipid metabolism, with some actually improving cholesterol profiles. The mechanism behind hydrochlorothiazide's effect on lipids appears to involve complex interactions with liver metabolism and insulin sensitivity. Research suggests the medication affects how the liver processes fats and how body tissues respond to insulin signaling, both influencing cholesterol production and clearance. Some studies found connections between hydrochlorothiazide-induced changes in glucose metabolism and simultaneous lipid alterations, suggesting these metabolic effects may be interconnected. Regular monitoring of lipid panels becomes important for patients on long-term therapy. Next, side effect 8, orthostatic hypotension and dizziness. Dizziness upon standing, medically termed orthostatic hypotension, represents a common and potentially dangerous side effect of hydrochlorothiazide therapy. Research published in the Journal of the American Geriatric Society has extensively documented this complication, particularly among older adults. Studies indicate that approximately 15 to 20% of patients experience some degree of dizziness, lightheadedness, or balance problems when initiating treatment or after dose increases. The physiological mechanism centers on hydrochlorothiazide's reduction of blood volume through its diuretic action. Normally, when you transition from sitting or lying to standing, your body rapidly compensates for gravitational blood pooling by constricting blood vessels and increasing heart rate to maintain adequate brain blood flow. However, with reduced total blood volume caused by hydrochlorothiazide's diuretic effect, this compensatory mechanism may fail. Research examining blood pressure responses in users documented delayed recovery after position changes, with some patients experiencing drops of 20 to 30 millimeters of mercury in systolic blood pressure. The dangers extend far beyond temporary discomfort. Studies published in JAMA Internal Medicine have linked diuretic-induced orthostatic hypotension to significantly increased fall risk, especially in elderly populations. Falls can result in fractures, head injuries, and hospitalizations. One large-scale observational study found that older adults taking hydrochlorothiazide had a 17% higher risk of fall-related injuries compared to those using alternative medications. Certain factors exacerbate this side effect. Research shows the problem worsens during hot weather when additional fluid loss through perspiration compounds the medication's dehydrating effects. Physical exercise, alcohol consumption, and taking the medication with other blood pressure-lowering drugs can all intensify orthostatic symptoms. While some patients adapt over time, others continue experiencing symptoms that significantly impact daily activities and independence. Next, side effect 9, gastrointestinal disturbances.
Digestive system complaints occur frequently among hydrochlorothiazide users, with research documenting various gastrointestinal side effects ranging from mild discomfort to more significant problems requiring medical attention. Studies published in the American Journal of Gastroenterology have shown that approximately 10 to 15% of patients taking this medication experience some form of digestive disturbance. These effects include nausea, stomach discomfort, diarrhea, constipation, cramping, bloating, and loss of appetite. The mechanisms underlying these gastrointestinal effects involve multiple pathways. Hydrochlorothiazide alters electrolyte balance throughout the body, including in the intestinal tract, which affects how the digestive system moves food and absorbs nutrients. Research has demonstrated that changes in potassium and sodium levels directly impact smooth muscle function in intestinal walls, leading to altered motility patterns that manifest as cramping, irregular bowel movements, and discomfort. Some patients experience nausea, particularly in the morning or shortly after taking their medication, while others develop persistent loss of appetite. Clinical studies examining gastrointestinal side effects found that patients taking hydrochlorothiazide reported significantly higher rates of digestive complaints compared to control groups. Research published in Clinical Pharmacology and Therapeutics documented cases where severe gastrointestinal reactions necessitated medication discontinuation. In rare instances, hydrochlorothiazide has been associated with acute pancreatitis, a serious inflammation of the pancreas causing severe abdominal pain and requiring immediate medical intervention. While this complication remains uncommon, case reports in medical literature confirm its occurrence. For most patients, digestive side effects remain mild and often improve after the initial few weeks as the body adjusts. However, persistent or worsening symptoms should never be ignored, as they might indicate the need for dose adjustment or switching to alternative medication. Research suggests taking hydrochlorothiazide with food may help minimize some symptoms. Understanding these 9 research-proven side effects of hydrochlorothiazide empowers you to make informed decisions about your healthcare. This information should never lead you to stop taking prescribed medication without consulting your doctor. Rather, this knowledge provides talking points for productive conversations with your healthcare provider about monitoring strategies and whether hydrochlorothiazide remains optimal for your situation. Every medication involves weighing benefits against potential risks. Hydrochlorothiazide continues helping millions worldwide control blood pressure effectively. Regular monitoring through blood tests, awareness of warning signs, and open communication with your medical team enable you to navigate potential side effects while maintaining cardiovascular protection. If this information proved valuable, please type "valuable" in the comments below. Your feedback genuinely motivates us to continue creating evidence-based content. Remember to like this video, share it with others who might benefit, and subscribe to our channel for more research-backed health education. Thank you for investing time in understanding your health, and we look forward to bringing you more valuable content.